One of the questions I'm often asked is, why are my exosomes so good? My exosomes are called EXOMD. The reason they're so good is we start with what I think is the best stem cell for doing anything in aesthetics or regenerative, like in orthopedics or even systemic for things like rheumatoid arthritis and lupus. So you want to have a stem cell called a mesenchymal. Some people say mesenchymal stem cell, and it depends on where it comes from. The best place is Wharton's jelly in the umbilical cord. There's tons of mesenchymal stem cells. And then what you need to do is once you get the stem cells from the umbilical cord, you have to have a great lab. And that lab has to have a great cell media because the stem cells are floating in that cell media. They use it as their energy, their food, it's their vitality. And the better the cell media, the better the stem cells. So the cell media has to be just as important as the actual place where the stem cell came from. Now, we don't want fetal stem cells. Why? Because fetal stem cells come with a lot of tumors. And also, there's the moral argument that if you do legalize fetal stem cells, you'll have a lot of women have abortions, develop fetal tissue. But EXOMD exosomes come from stem cells from Wharton's jelly, which are mesenchymal stem cells. You don't have to worry about any transfer of like a COVID vaccine. You don't have to worry about that. That will not happen with mesenchymal stem cells from Wharton's jelly. But the cell media is key, and it's taken us over 20 years to tweak our cell media to get it just right, which is the reason why we have the only exosomes that are stable at room temperature for 2 years. There is no other. We're never lyophilized, so we're not freeze-dried, we're not powderized, which ruins the structural integrity of the exosome. And we have the best nanotracking analysis in the world. And when you look at nanotracking analysis, which I can teach you how to do very easily, I can tell by the lines on the chart that the quality of our exosome is better than the quality of any other exosome at any other lab thus far in the world. On top of that, I then clinically correlate and see the results that I get. And that's how I know I have the best exosomes.